I'm Vonnie Arith. I'm an RN with Bismarck Burleigh Public Health. We have numerous services for all ages throughout the Bismarck, Mandan, and Burleigh County area. We see anyone, so if they come from out of state and want a service, we do not deny them those services. We have various programs for infants all the way up through elderly. Some of the programs with infants, our main one is our immunization program. And right now the state of North Dakota provides the vaccines to the public health agencies, so there's just an administration fee for the cost. If individuals are not able to pay that, we certainly as a public health agency can waive that. So we want to protect every infant and child in our community. Adults, many of the vaccines we have to purchase privately, so we do ask for a cost because we have to pay for them. We are also a site in North Dakota that offers international travel vaccines, and of course we have to pay for those, and so individuals have to pay, and unfortunately the insurance companies have not picked up that cost. So we have asked them numerous times why, and they said if individuals can afford to travel, they can afford to pay for the vaccines. And some of them are costly, but if you think of the disease versus protection, you opt to go for the protection. And that's our main focus, is prevention and protection of individuals in the community. So our immunization program is big. Then we do some child physical assessment type things. We have a program called North Dakota Health Tracks, and that is for anyone 0 through 21 who is on medical assistance. They are to have an annual physical one time a year, and they can opt to either go to their physician or they can opt to come through North Dakota Health Tracks. When they come through the Health Track program, they get a couple extra little things. Their teeth are fluorided, and we offer the immunizations right at that time also. So that's a nice program. We do have well baby visits. They're only one time a month, and we have a little agreement with the UND Center for Family Medicine where the resident that's on pediatric rotation comes down and we'll do the physical assessment, and if the baby has an ear infection, they can write the prescription right there so that they don't have to go back to the doctor, and then the nurses will give their immunizations if they need it, and do like a Denver to check if they're growing properly and their movements that they need are functioning at their age level. So that's a nice program. We have a nurse of the day, which every day from 8 to 12 and 1 to 5, individuals can come in for almost anything they can go to the clinic for, except we don't have a doctor on staff, so there's no prescriptions and of course no x-rays. But we do immunizations, we do head lice check, we do foot care, we do removal of splinters, we take out stitches, it just goes on the gamut of nurse of the day. And anybody is welcome to come through for that. We ask for maybe not a suggested donation, but there is a little fee. But some of those things, if they are absolutely unable to afford it, like homeless individuals or uninsured individuals, our city commission, which is our bosses, have opted to let us reduce that cost. Even if they can pay $1 towards the service, that is fine. So that's a great program. We also have been asked by the State Health Department to do STD, sexually transmitted disease testing, and hepatitis C testing, and HIV testing, and all that is very confidential. We have a private room that we do that here, and anyone can come through that service. The STD charge is a $15 charge because that's what the state lab charges us to process the sample. HIV, if you're high risk, and the Hep C, if you're high risk, is no charge. We then move on to home health. We have individuals that go into the community and visit individuals that aren't able to get out on their own. Doctors sometimes refer individuals to have their blood pressure checked one time a week in their homes to watch what the blood pressure is doing, because when you go to the clinic you sometimes have an elevated blood pressure, and they call that white jacket syndrome. So they ask us to do it for like 6 weeks, and then they take that blood pressure. We do a lot of setting up of medication for individuals that can't see, to do their own medications, things like that. And then just to maintain elderly, to keep them out of the nursing homes. We have visited extensively with the police and the firemen and public works employees regarding any red flags that they may see, and we should contact an individual to see what's going on in their life. Example is the police may be called by Kirkwood Mall 3 times in a week that a grandpa has lost where he parked his car and doesn't remember. So that's kind of a red flag, like maybe you need to check on their mental status, and we can do that without a doctor's order. So the police will contact us and ask to make a visit, and we can do that. And then we work extensively with the families, or protection and advocacy, or the guardianship program. Fire department, they'll notice if something isn't right when they've been in the vicinity, and then they'll call us and ask to visit. Public Works may notice, and they have called us on a couple occasions when they go down the alleys and pick up garbage, that either there's been no garbage for a long period of time, or a lot of garbage all of a sudden, or twice they have found individuals that have fallen on the ice and couldn't get up, and so they've called us to make a home visit. So those are the things that anybody in the community, if you're concerned about an individual living across the street, that they don't have any family, something may be going on, they certainly can call Bismarck Burleigh Public Health and have a nurse make a visit. I don't have a number in my head because each program is different, but our numbers are in the thousands. We know that because we do the entire county. And we do numerous clinics. We do blood pressure clinics out in the community. We do immunization clinics here, but we do flu clinics in the fall in the entire county. And of course all the individuals that come in here. So, sure.
And what are some of the barriers and obstacles you see facing those you serve?
Barriers are usually cost of going to the doctor or to pay for their medication. I am a member of the Missouri Valley Homeless Coalition, and the individuals from the agencies have all tried to assist the low-income, uninsured, or homeless individuals to pay for their medication. And many times there is not a nurse on their staff, so they don't know what the medication is, and they ended up paying for like narcotics and things like that. So they have, we have kind of come to a consensus that they would all call me or refer the individuals to me, and then I could determine whether it's a narcotic, which we would not pay for. And then I would contact the pharmacies, and we would try and help them one time a year for their medications. Or I work with the North Dakota Insurance Commissioner's office, where and then individual can do this themselves, is call them, and they may set up working with the pharmaceutical company for a specific medication. The doctor signs the forms, the individual signs the forms, and then they can get free medications for anywhere from 6 to 12 months. There's also called the North Dakota Prescription Drug Repository Program, where individuals may not have picked up a prescription, and so we can tap into that and get it for probably like $8 or something like that to help an individual. So I do a lot of research, and there is also a couple pharmacies in Bismarck that will work closely with us in public health and know that these individuals can't afford it, so we can get medication at a lesser cost for them. Bismarck Burleigh Public Health's phone number is 355-1540, and our email is bbph@nd.gov. Our address is 500 East Front Avenue, which is directly on the north side of the Civic Center.